Good afternoon and welcome to This Week in Digital Health. We are speaking with Owain Hughes of Cinapsis. So Owain, can you tell us a little bit about what you're working on?
Yeah, thanks, Mark. So at Cinapsis, basically, we have built a digital platform that connects clinicians. So making it easy for clinicians to communicate with each other, share information securely, and support each other basically to make more informed, better decisions about what treatment plans patients should have. So a typical example is, clinicians in the community, a general practitioner or a pharmacist or an optician or a paramedic seeing a patient and they're thinking, what do I do? So they would use Cinapsis to connect with a specialist in the hospital to get advice and make a plan about what to do next with this patient.
And why did you pursue this? What was sort of the gap in the market that led you to this?
Yeah, so my background is I'm an ear, nose and throat surgeon. And in my work, what I saw was, a lot of patients were, one, waiting a long time to see me. Two, when they arrived, they're often very anxious. So some of them would be referred, with a suspected cancer diagnosis, for example. And, within, 30 seconds of reading their notes or starting talking to them, I knew the chance of their having cancer was absolutely minuscule and they'd been referred inappropriately. And I also knew from my experience of working with, junior doctors, supporting them, answering their queries, that actually you can really upskill somebody. If they're seeing a patient and they don't know what to do and they had direct access to me, I could really upskill them. They could describe the problem and it would kind of make sense to me. And I could say, okay, ask them a few questions and then give them a management plan. And it just surprised me that when those same doctors, finished their training and now were working out in the community, how isolated they were, and how this isolation was really not serving anybody, is causing patients to unnecessarily wait to start treatment or, have to travel to access specialist advice. And those clinicians are isolating the community who are very anxious. They anxious about doing the wrong thing, anxious about missing something. And, that anxiety was causing them sometimes to refer patients where actually just a bit of advice would have, given them the right treatment plan.
Yeah, I mean, this is indicative of a bigger problem within healthcare in that we've seen, the data silos that exist and, how difficult it is to share information. We were working with a hospital, a relatively large training hospital in Europe, and in a digital transformation project, and they had 46 data centers that didn't talk to each other. So the only way to communicate was to physically send a paper file, so then, one, that's very time consuming, it's prone to, human error. Why is there so much difficulty in this day and age with communication in healthcare? Your voice is gone.
Can you hear me now?
Yeah.
Yeah, I lost you for a few seconds there.
Okay. What I was asking was, we've seen in healthcare sort of this challenge with communication. We gave sort of an example of a hospital where there were 46 data centers that couldn't talk to each other. The only way to communicate was through paper files. And I'm asking sort of why in this day and age do we still continue to have such challenges communicating within healthcare?
Well, exactly, exactly. Why is it like that? The most critical, sector where, communication is key. Why is it so archaic? Why are the systems so archaic? I think one of the reasons is that clinicians are very pragmatic. Clinicians will get the job done regardless. Give them no tools, they will care for their patients and they will make do and often not complain and just get on with it. And I think there are so many workarounds in the system that clinicians on the front line, they have just learned to make do. But, you know, healthcare is getting more complicated, and maybe these workarounds were fine a few years ago, you know, a decade or so ago, but, you know, the system is really creaking now because you can't keep all the information in your head, you know, and if you're a specialist even, you know, it takes all your time for your small speciality within the breadth of medicine to keep yourself up to date, you know. So if you're a generalist working in the community, there's absolutely no way you can be on top of everything that's happening. So
Yeah, I read a study that, you know, in order to be sort of up to date, you know, a physician would need to, you know, do about 75 hours a week worth of research, you know,
yeah,
with all the latest studies. I mean, and that's obviously practically impossible and still see patients. You know, so we need a better way and a better tool to access, you know, what's current, what's advisable. And I'm assuming that's where Cinapsis comes in.
yeah. So we, you know, now we connect humans, you know, so there is experiential experience, the experience of having done the job, you know, having seen thousands of patients, you know, with these conditions. You know, a specialist with that level of knowledge is extremely valuable, and they take, you know, years to train. But the problem now is that they are stuck within buildings. They are stuck in the hospital. And, you know, the way healthcare is changing is that actually a lot of this knowledge has to be disseminated. It has to be much more accessible than there is today. So it's no longer acceptable to say, you know, I'm the neurologist. You have to come to me to access my knowledge and experience. You know, it's now all about population health. So the only way we can meet the increasing needs of the population is to disseminate this knowledge, to make
It's
it
also
more.
about a holistic approach rather than a specialist approach, right?
Oh, quite exactly. So, you know, the old fashioned, you know, prevalent model of medicine is, you know, you go and see a neurologist, they deal with that problem. You go and see a cardiologist, they deal with another problem. You know, a better approach and the direction of travel is that you have a, you know, family practitioner or a general practitioner, we call it in the UK, whose job is to support you through your health, you know, maybe your whole life. That they know you, they're your advocate, they access. We call them consultants. We call specialist consultants in the UK. So they access consultancy on your behalf. Say, well, you know, could this be a neurology problem? Let's check with the neurologist. Let's ask them some questions. You know, why is she short of breath? Is it a cardiology problem? Is it a respiratory problem? Is it a combination of two? You know, let's get people to give their opinion on your condition right now. You know,
Yeah, and that, because one of the challenges that we've seen in the past is, especially when there's comorbidity, is they don't, you know, there's no one looking at the big picture, right? The specialist, you know, if you go to an oncologist, they will focus on cancer, and, you know, without looking at, you know, what else is going on, and with, you know, what the impact of what they're proposing is on some of the other sort of existing conditions that may, you know, be a factor in the patient's prolonged care or, you know, extended care.
yeah, and all these things they overlap. You know, one thing impacts on another, as you say, and you know, these conversations typically from a patient point of view, they're spread out. You know, weeks apart. You know, often miles apart if they're happening in different, you know, different hospitals. So, and it's just such a crazy way of doing it. If you were designing it, you wouldn't design the health system as it is. You know, it needs to be much more patient focused. You know, the patient have much more information now. You know, often, you know, patient would benefit from an advocate. You know, somebody who's medically trained. You know, who can help. You know,
Ask the right questions.
ask the right questions exactly, and just help guide them. And I think, you know, I think this is the direction of travel, really. You know, much more patient focused, much closer to home. You know, and advocacy and accessing, you know, the right advice and bringing all of that together. And really, that's the, you know, that's what Cinapsis is helping with this change, really, from, you know, a specialist focused health system to a more patient focused health system.
And the product is live and in the market at this point?
Yeah, no, absolutely. So we're live in several areas in the UK. So our system is bought by Whole Health Systems. So and across specialities. So we're now serving about 25 different specialities, from pediatrics, palliative care, orthopedics, ear, nose and throat surgery, respiratory cardiology. So across the board. And really, it's empowering the clinicians in the community to get that specialist advice, in real time. Often, what's wrong with this rash? What do I do with this child who's got abdominal pain? And it is really dramatically. First of all, it's dramatically changing the relationship between specialists and clinicians in the communities. It's a much more collaborative approach, a much more supportive approach, and it's changing the way patients are managed. Patients are having to travel less to the hospital, and that has such a dramatic effect on the working lives of clinicians in the hospital. So, one of the questions that we had was, why would they want to do this? And the reality now is that hospitals are overwhelmed. There's so much work coming their way. They need to think differently about how to, select out the patients who really need to be in the hospital and provide support outside of their building for all the other patients.
And how are both the primary and the specialists, do they like this? Do they find, this is helpful, or do they find threatened by it? What is their response?
I'd say they love it. You may say I would say that, but they do.
Sure.
They love it. So from the primary care clinician, you can see why. Before they were isolated in the community. Now with one click, they just launch the system, say what the problem is, and they're talking to somebody. Somebody who's very experienced in that problem, sharing information, answering their questions. So it's, you can definitely see the benefit from the primary care point of view. From the secondary care, from the specialist point of view, it's helping them manage demand. As I said, rather than seeing, like was my experience, I thought, a large proportion of the patients that I thought, they don't need face-to-face time with me here. There are several steps in this patient's care before we're going to even think about an operation. And the ability to say, okay, this is the treatment plan. We'll see them once we know that we can add value. And specialists really value that. They see the value of that. They know their time is precious, and they want to spend on the patients on whom they can have the most impact. So, and it's taken us a long time to, tailor the software to serve these, on the face of it, competing needs, seeking advice and providing advice. They're complementary, but very different. And we've had to understand, what is the pain point in each clinician's working day that Cinapsis can help with. And it's really those insights that make the product sticky and liked by our users.
And then, mechanically, do you have a pool of specialists available, or is somebody on call? How do I connect with a specialist using Cinapsis?
Yes, so we have two models basically. So the first one, and the predominant one, is we support existing relationships. So we provide just the software in the middle that connects, so primary care clinicians, they will have a hospital where they send their patients. And where health economies have bought Cinapsis, it's deployed everywhere across there. So there is an existing relationship between clinicians in the local hospital and the people who refer into them. So that's the predominant model, actually, is supporting existing clinicians with existing staff. The other model that we have, which is less but increasing, is we work with organizations who have their own staff working remotely. So we don't employ staff ourselves. We are super focused on the software, getting the platform right, and working with good partners, and there are many partners whose core job is to recruit and validate staff, and we work with them, and we say to them, our job is to make you look good, to when people use Cinapsis to access your advice, it's a great experience, and we're working with a number of partners like that.
And how do the payers perceive this?
How do the
payers? The
payers?
Health insurance.
Yeah. So yes, so we have a single payer system in the UK, and their issue is like an accountable care organization, if you like. So they're divided into regions in the UK. Their problem is managing demand. They have a fixed budget and demand is going up. One of the things that Cinapsis gives them is visibility of where their money is going. So, money is spent by a payer when patients move effectively. The patients moving from, primary care to specialist care, that's when they pay the bills. Now we give them data on, what conversations are happening, who are they about, what clinicians are involved in that conversation, what is the outcome of that conversation, and actually also what ultimately happens to the patient. So where before, say if you're a hospital, you only get data on patients who actually walk through your door. But now we can give them data before, several steps before that. Okay, what led to this patient coming to this clinic or coming to the accident emergency department? So payers, one, they like giving a great experience to their clinical workforce, but what they really get is that data. And not only that data, but the ability to change outcomes in real time. So they can build new pathways, have different outcomes available to the specialist, so they can change the flow of patients pretty quickly.
And have you been able to demonstrate sort of the value-based care model where by using this tool, less patients are actually having to go to the hospital, or less patients are, there's less readmissions? So, the typical metrics that we use to understand whether or not, we're being effective and cost efficient, things like that.
Yeah, no, absolutely. We know, so for example, for dermatology, about 70% of patients stay in the community. We also
that represents a considerable cost savings to the payers.
Correct? Oh yeah, it's huge. It's per area, it's well, several millions of pounds per year. It's a huge saving. And for unplanned care, urgent care, we know that using Cinapsis changes behavior about 83% of the time. So 30% of the time the patient stays in community care, but 53% of the time they still go to specialist care, but somewhere else. So they don't go to emergency care; they go to a more planned part of specialist care, which is obviously cheaper to deliver, easier to deliver. So yeah, it has a huge impact across a health economy.
And that typically also results in a better patient experience, right? Because nobody wants to go to the ER. The emergency room. It's not, you sit around, you wait. Whereas, in this scenario, you have an appointment, you see the specialist, that's a better experience.
Yeah, better for the patients, quicker treatment, less anxiety, better for the environment, less traveling. So yeah, it has a huge impact actually.
And I'm assuming based on how far along you are, you launched this pre-COVID.
We did. So we launched in January 2019, and really COVID accelerated our growth really, because just before COVID, I think people were recognizing this as, the future of healthcare, that, this is how healthcare is going to be delivered in the future. COVID made it an imperative. It was an imperative to keep patient out of hospital. It's actually dangerous, obviously, for a patient to come into a hospital unnecessarily. Sure. Dangerous for the patient, but also dangerous for the staff. So that really, fueled the deployment of Cinapsis, because it became from an inevitability in a way, a realization that this was the way healthcare was going to be delivered in the future, to an imperative, and that really accelerated our growth.
And does this also sort of speed up the care process, because typically, if I was referring to a specialist, we had to wait to get on their calendar and you had to travel to see them. Where now, if it's just a consult, hopefully that happens within 24 or 48 hours. You get more feedback faster. So that would seem to move the process along.
Yeah, absolutely. That's the idea. That's the ultimate benefit, is that, not only are patients going to get better treatment, but they're getting that faster. They're getting the appropriate treatment, closer to home, quicker, and in ultimately a way that saves money to the health system. So it's really powerful. Absolutely.
And who ultimately pays for your product? Is it the payer? Is it the provider? Who pays for the product?
So that's a very interesting question. So ultimately,
sometimes touchy, but sorry.
Yeah, no, it's been the payer that pays us,
Okay.
but a lot of the benefit is realized by the provider. So I think that there is a realization of that, where the benefit sits, because the provider actually, it depends on how they are reimbursed. So some providers have a block contract, so they say this is the amount of money you have to care for this population, where others are payment by results. But regardless of the model of reimbursement to them, what it means is they can keep low tariff work outside of the hospital, deal with that just with advice, which is cheaper and more convenient to deliver, and focus on high tariff work. There's a lot of benefits there, but our customers have almost invariably been the payers.
Well, because one would think you're changing the care outcomes, right? Because like you said, you're keeping people out of acute situations. If it's not necessary, we're not suggesting that if it is necessary, obviously they go. But in the situations where they didn't necessarily need to go to a specialist, they just needed some advice or some feedback, that that's considerably cheaper in the long run, right?
Yeah, it also has a huge impact on the working life of clinicians. So this is a huge, for some providers and some specialities, retention of staff is a huge issue. For example, pediatricians are few and far between. So if they, are overburdened by just the amount of patients they're seeing, retention becomes a problem. So by, keeping a large number of patients outside of the hospital, supporting them to be managed in the community, it means that, the day-to-day work is more manageable, it's more predictable, and it happens in a calmer, more structured environment, which helps with the retention of staff, actually.
Which is sort of running through my mind is typically most of the digital products that we see are most often utilized by the support staff, right? And what I'm hearing from you is this is a product that we're really connecting the caregivers, because a lot of what we see, the nurses, this facilitates and helps the nurses with scheduling and all of that. But this is a case where it's directly how much of this is utilized by the support staff versus the care provider?
Yeah, so our primary users are the clinicians. So those are, our primary users. So we're really focused on that. So most of our users are clinicians by far. But what we found is that, there's a lot of tasks to do. So after you give the advice, they say, okay, we need to see this patient in a scheduled clinic next week. Well, that needs to be booked. Right. Somebody needs to be informed that this patients are on their way. So there's a lot of adjacent tasks that Cinapsis is growing to support, basically. But our core users are the clinicians. Our product has to give an excellent experience for our core users. That's the focus for us. And if they use it, then there's lots of things that Cinapsis can do, and those are kind of the added benefits. And that's why we've become very, very sticky, because one, we do the communication bit well, but also we help with not just giving the advice, but actually how do you deliver that care? What needs to happen next? And we've focused a lot on kind of integration and moving data around and informing people.
Yeah, and obviously you are dealing with a lot of sensitive personal information. So how do you deal with security?
Yes, so that, that is a core competence of ours. So we deal with it by complying with the standards. So in the NHS in the UK, there is a process. It's called the Data Security and Protection Toolkit, which is an ongoing process basically, and it has many mandatory requirements around how you handle data, where you store it, your encryption, that you undergo penetration testing. So there's lots of things. So we fully engage with that process. Obviously, it's a core requirement of what we do. So that's one thing. The other element of it is patient safety of the technology. So in the UK, every health tech company has to have a clinical safety officer. So that's me, has to be a clinician, and your job is to document all the hazards that could be associated with your software, and how it's implemented and how that can impact on patients and what mitigations are there. So there's these two elements. One is data protection, cybersecurity. The other aspect is clinical safety. And these two things are absolutely core to what we do.
But I would also imagine that there's an education component with the clinicians, right? To make sure that they're using it in a proper manner. We've had, providers that, with all good intent, will do things that clearly, put their data at jeopardy. They'll text something or something like that. And we have to explain to them, no, you can't do that. You know what I mean? But the patients love it. I'm like, we get that, but that's not a secure channel. So stop doing that immediately. You know what I mean? So I would assume also that part of this, you have to sort of help educate the clinicians to make sure that you can, continue compliance.
Yeah, sure. And that is important for every healthcare organization, that they, and every organization, healthcare organization in the UK, it's mandatory for all staff to do data protection training annually. So, we just ensure that our users comply with that, so that they have an awareness and an understanding of their responsibility, personal responsibility and professional responsibility when it comes to protecting data. There are, safeguards built into our technology that help them with that. So, for example, they can use our app. Nothing is stored on their device. Nothing is stored on their personal cloud. Every image that has consent or is taken in the patient's best interest if consent cannot be taken. So all these things support our users to comply with their responsibilities and their obligations under the law. So yeah, and there's a big education piece around that, and user training, and we focus a lot on kind of education and onboarding and training and compliance, in the things that we do and how we deploy, for sure.
So now that you're in the market and you have stickiness and the clinicians like it, what's next for you? What's on your growth plan?
So what's next for us is to keep doing a good job. I think that is what I've learned is the most important thing. So keep focused on our users, keep giving them a good experience, supporting them to tell our story. So we found that actually getting our clinicians to tell their story about how Cinapsis is helping them help their patients. And, that's driven our growth. So our focus is keep doing that, and really, excellent technology used by clinicians is few and far between, actually. So, we just need to keep doing a good job. And, our growth will look after itself, I think.
And then is your intent to grow within the UK or to grow into other markets? What is the plan there?
Yeah, so certainly within the UK. So there's the UK is a big market. We're one of the companies recognized by government For
I gotta call you back, okay? Sorry.
that,
Joy of being live, right?
yes, quite. So yeah,
You were
so
talking about you were expanding or expanding within the UK.
yeah, within the UK, absolutely. That's our focus, certainly for the next 12 months. We're one of the companies recognised for digital health for exports by the UK government, and export is a big part of the government strategy now. So we're engaging with that, and we're open to opportunities abroad. But our main focus currently is in the UK.
And how have you accomplished this to date? Are you bootstrapped? Are you funded? What has been your startup path?
Yeah, so we self-funded. So that's how we started, and being funded by by contracts. So we flirted with VCs and so on, but really what I realized was a lot of our issues early on weren't money issues. They weren't because of lack of money. They were time, and giving the product the opportunity to bed in, to get those user stories. And I'm glad really that we've taken that route, because it's made us really focus on what's valued by our customers and understand, how to go to market, what messages work with customers and what they're looking for. How can we add value? And sometimes getting external money and this push to grow very quickly can distract you from that. So I think we've learned an awful lot from the process that we followed.
And as things begin to open up, what do you think will change for you?
As things open up, I think things will continue and accelerate along the path that we've seen during COVID. Actually, I think in healthcare, people have recognized that, wherever possible, we should help our patients to avoid unnecessary travel to a hospital. We realize that, it's been spoken about for a long time, but now people absolutely, viscerally understand it, that the best care is closer to home. So I think as things open up, I think our growth will accelerate, actually. I think people are, one of the things that COVID has caused is a massive pent-up demand. There's a huge waiting lists now of patients waiting for specialist treatment, and that needs to be sorted. And Cinapsis is one of the solutions to do that. Cinapsis allows providers to manage demand. There's a need to increase capacity, which is kind of buying new staff in. Cinapsis allows them to manage demand, and that is a core thing. And I think, yeah, the imperative to do that as we open up will just increase now.
Yeah, I mean, we've seen and we believe that, once the horse is out of the barn, there's no going back, right? That, this digital experience has greatly enhanced how we can provide care. So why would we go backwards at this point in time? So, we see a similar, path forward where digital health, telemedicine, e-health, all those things that have been pushed along as a result of the pandemic, people will continue to want them, and still be, cautious about, having to go places physically in person if they don't need to. So
yeah, exactly. People have, most people, I guess, have lived their whole lives for months, remotely. So, people have realized that they don't need to travel as much.
Well, we very much appreciate you joining us today. It was great having a conversation. Sorry, my sister called in the middle of it, but it's sort of the joy, right? We very much appreciate your time, and we look forward to some exciting things in the future from you guys.
Fantastic. Thank you very much, Mike. Great.
Thank you.